Okay. APG-2449 is the second generation of ALK and ROS1 and also FAK inhibitors. We like to call it dirty compounds because it's not selective inhibitors. It have a very wide of the inhibition of those tyrosine kinase. So this drug, we have to report this phase 1 trial in eClinical Medicine this year in October. So the magazine is one of the Lancet population group. So this drug, we have performed this phase 1 clinical trials, including dose escalation and dose expansion studies, which the main purpose of this, the main objective of this phase 1 trial is to determine the NTD and the RP2D in the first stage, which is the escalation stage of this phase 1 trial. And also when we acquire our objective, we start to expand in RP2D for those expansion, which is the second stage of this phase 1 trial. So totally we have 200 patients were screened for eligibilities, and finally we have 144 patients enrolled. That is 88 patients in dose escalation stage and 56 patients in dose expansion stage. All the patients will receive APG-2449, and in the dose expansion, we have found RP2D is 1,200 milligram. So all the patients, we divided into 3 parts. One part is the solid tumor, advanced solid tumor. When we do the dose escalation, we include not only non-small cell lung cancer, not only patients with ALK or ROS1 mutation, we also including some malignant pleural mesothelioma and ovarian cancer. Not very much, only 14 patients. And the rest of the patients enrolled, including 130 patients, was non-small cell lung cancer. All of them are ALK or ROS1 positive. We divided it into 4 groups, which is ALK-naïve, just have not received any prior TKI treatments, and the ALK TKI failed patients, and also the ROS1 TKI-naïve and the ROS1 TKI failed patients. So when we divided it into group, we can see the very promising results for the patients. The results shows the efficacy for ALK-naïve population. The objective response rate was nearly 80%, which is very high. And for those which we most focus on, the patients have already failed on second generation TKIs. The objective response rate is 22%. That's when we look at the patients receiving a high dose levels, the objective response rate have raised to nearly about 50%. So this is why this drug could be promising and be accepted by the population group of Lancet. So this is the main reason, because they have a very promising effect for those who have failed on second generation population, which leads to the most important questions of the PD study. So when we look into these patients, we realize that the phosphorylation of FAK is a very important mechanism of drug resistance, which is very important. But because APG-2449 is not only an ALK and the ROS1 inhibitor, it also inhibits the phosphorylation of FAK. I don't know if you recall, this year, early in this year, there is a clinical trial for the patients with KRAS G12C, the patients using KRAS G12C inhibitors and plus the combination of another drug, which is the inhibitor of phosphorylation FAK, which have a very promising OR. All the patients have objective response. This is very promising. So if we just the similar of KRAS G12C for the patients with ALK positive and ROS1 positive, for them have failed on second generation second generation TKI. A lot of the patients were because the acquired resistance of FAK phosphorylation. So for this drug, it has the inhibition ability to phosphorylation FAK. So when we do the PD analysis, we found that the patients have baseline phosphorylation FAK, the expression is high, have a very, very promising, very good efficacy, have an OR of nearly 70%. So this is the main reason that's why this drug have the ability, have the worthy of further developments.